Hello everyone, here we are at Richardsons today scheduling this patient who has travelled from a far off place, over 9 hours of travel, and he's reached here for a rhinoplasty surgery. So the plan is to do a open structures rhinoplasty with rib grafting. Let me first point out the concerns of this patient. As you see on the lateral view, he has a depressed radix, also a dorsal hump, which we are going to augment using the rib graft, the dorsal graft, right from the radix, which will cover the hump together. This will also increase the dorsal height. So we are going to do some amount of dorsal augmentation which is suitable for his depression here, so that it looks even up till the tip. Also giving him a tip projection, and finally we will be reducing the alar base by doing a alar base reduction bilaterally. So this is the plan. This will require rib grafting, and this procedure should take us anywhere between 2.5 to 3 hours. He does not have, do you have any breathing issues?
No, I don't have any breathing issues. Breathing is fine. It is just cosmetic problem.
Yeah. So as he said, it is a cosmetic rhinoplasty. Patients are so well aware as to what is functional, what is cosmetic now. So that's good. Also, are you scared?
Not so much because I have seen Dr. Richardson's videos, and I know that he is a widely renowned and very capable doctor. So I am least bothered, and I wish that when I wake up from anesthesia, I will have what I always wanted.
Sure you will. And what he said about Dr. Richardson is true. So yes, we will be shifting you now to the OR, and we will start with the surgery shortly.
Nose job. So we're going to make this nose more proportional to his face. We're going to be increasing his length and also the projection, the tip, reducing the width and making it more deviation. As you can see, we're going to correct that as well. Cosmetic nose job. So you can see how he was before we started. The nose had a dorsal hump, depression at the radix, and also you can see the tip. So his nose needed to be longer on his face to get more proportional, and we've done just that. We've made it slimmer as well, less broader. Nose is really flat. It's 2 times plus broad than the height, and now we've reduced that Look down. You can have a look. You happy?
Yeah, very much. Thank you.
You're welcome. So we haven't changed the racial look of your nose or anything, but just altered the proportions so that it suits your face much better. And also because you have very thick skin, I've retained that, but still you see from the side view, if you see, this is how it is, and now if you see, it's a nice straight line.
Yeah.
So that
there used to be a bump.
So the bump is gone, and we've increased the height here. So there should be a big depression there,
Yeah.
So now it's got a nice gradual thing. That's the radix. And then of course the tip, reduction in the width, reduction in the bony width there.
Yeah, and these are just the initial results. Like with months, it will also.
It'll come down, but pretty much this will be the proportion. In your case, you don't expect something
drastic.
Nothing much should happen drastically. It should be pretty much the same.
I'm really happy. Thank you.
That's glad. I'm glad to hear that. Take care. So we'll take off the sutures,
Yeah, sure.
and do remember before you go abroad, it heals well. Because see, it takes 4 to 5 weeks to heal, especially when we do anything with the bones. I like to tell this to patients so that you understand. Very often patients feel fine after 2 weeks.
Okay.
You said you're fine right now.
Indeed, yeah.
But remember, healing is incomplete yet.
True.
Therefore, you need to take adequate cares and adequate precaution. Take the medications. Don't let anything, injure your nose, or be very, very careful.
Yeah, indeed.
And that's because if it does happen, then it's extra headache and then all of this stuff. So we'll take off the sutures.
Yeah.
We'll prescribe some more tablets for you, basically for swelling.
Okay.
Continue that. How's the pain from the rib?
The rib pain was well, it is not there anymore.
Okay, but initially.
Initially also I didn't find it because the pain meds were really good, so
Okay.
I didn't notice it. Like
Didn't feel
initially-
much.
Yeah, like on the day when it happened, there was a little bit of pain.
Okay.
But two days after, it was completely.
It was
gone.
completely good. That's
So
nice
I
to
can,
know.
Get from my back to my front.
Awesome.
Yeah.
So this is something I tell patients also, like in case after anesthesia you feel pain, just let us know.
Indeed.
Because then we can alter the pain meds or increase the dose or change one, and then make sure you're not having pain. So that's nice. Increasingly I find 90% of our patients say there was really no pain anytime, which is actually the goal.
Yeah.
Because we are doing a cosmetic procedure, and if it's as little pain as possible, it's better.
Yeah, for me, it was really smooth. So
Cool.
These injuries also didn't hurt at all. This rib graft is also-
Nose, it doesn't hurt generally for anyone. The rib is something that some people do have some pain.
For me, it didn't hurt. in the
Everything
rib part
fine.
also.
That's nice to
So
learn.
The recovery
Happy.
was really nice. Yeah.
Awesome, man. Take care. All right. So we've also given another follow-up number for you.
Yeah.
So do send in your queries, pictures, everything on that number, and not on the original WhatsApp number that you contacted us, because that's crowded and that's busy.
Yeah, I do understand.
Yeah. So follow up. This is a dedicated one,
Okay.
and also a doctor will be handling it.
Okay, sure.
All right. Take care.
Thank you.
Bye. So